We have with us today Dr. M.Rau of the Paracelsus Clinic in Switzerland. Paracelsus is a world-renowned biological medicine clinic focused on combining the best of conventional medicine with other approaches that tap into the innate healing and health restoration capacity of the body. Dr. Rau and his colleagues are thus very much focused on the body's regulation systems and the nervous system, looking for what's interfering with proper functioning and then removing these issues to restore health. It's an approach that is fundamentally different than the suppress the symptoms model, instead looking to support the body's natural intelligence. People travel from all over the world to the Paracelsus Clinic because it is known for understanding the root causes of illness and for better outcomes. Welcome to electromagnetichealth.org, Dr. Rau.
Thank you very much.
Dr. Rau, how concerned are you about the proliferation of cell phone towers and antennas and other wireless technologies in our world today?
Well, this is really a problem. We know from our patients, but we know also from studies which were done in Switzerland and Germany that cell phone towers, they can interfere with the patient very much, and they can produce real disturbances of the unconscious nerve system, mainly on the unconscious nerve system. What is unconscious nerve system? That's the system which regulates the body without that you can do something. For example, heart rhythm, or the breathing, or the digestion, or all these things which you do not steer by intention, but they are steered by the unconscious nerve system. And this can be severely compromised by mobile phone towers.
So how many patients do you see there at Paracelsus annually, and what percentage are you finding have symptoms of electrical sensitivity?
We have in our clinic, we see per year 3,000 new patients, and we see 10,000 patients per year, because we are 9 doctors here, and we have all very active practices. It is always difficult to say how much does the towers, the electromagnetic load, contribute to the disease, because there are always other factors too. There is always the discussion from the ignorance, from orthodox medicine or from the authorities, that they say, well, if it would hurt so much, everybody would suffer. That's an argument which they always bring, and not everybody suffers. It's only a certain selection of people who suffer from these loads. That's true. And this is explainable because the fact that it hurts you needs the other things too. For example, a lack of minerals or a lack of vitamin B is very frequent. Other things which also interfere with the unconscious nerve system, mainly, for example, heavy metal load. We know that patients who have heavy metals from amalgam fillings or from implants or from root canals, they tend to suffer much more than people who don't have heavy metal load toxicity.
So many people have been getting their mercury fillings out over the past decade and really feeling significantly better, and I'm wondering how much of that is related to actually removing the neurotoxin from the mouth versus removing a hot spot being created because we're living in a world with so many electromagnetic fields and they are metals.
Well, both is true. The hot spot, you can compare with the radio station and the radio receptor, the radio itself. You need to catch the vibration of the radio. You need an antenna. You need a radio device. And that's the same thing in the human being. The waves are around, and you need your individual antenna which fortifies it. And this fortifying can be an implant, a root canal, or very much a amalgam fillings. Therefore, when we have a patient who says, oh, close to my house they built a tower and so on, and since then I'm sick, well, this is very well possible. And then I say, we need to change your antenna. And this would be the first approach before you move out or before you sell the house. We can try this, and in about half of the patients it really works. Their resistance to the waves, to the electromagnetic load gets much better. But of course, this is not an excuse to say, well, radio antennas at electromagnetic towers are harmless. It would be totally wrong.
Dr. Rau, can you give us a sense of what kind of problems you're seeing in the clinical setting? Can you tell us some stories? What's happening?
One case, very solid kind of 35-year-old man, really somebody who stands with 4 legs on the world. Absolutely not a neurological or psyche patient. And he got sick, and he got a trigeminal neuralgia. He went to several doctors. He went to the university clinic, and they all said, well, it's just idiopathic. It just comes from, well, nobody knows, and you have to live with it. But he could not live with it. He even got suicidal. Then he came to us, and we found that there is a root canal with 2 metals in, and on the root canal there was an amalgam filling. And then we said, well, you have to remove this. And he said, well, I have this 20 years before, 15 years even before my neuralgia came. And the neuralgia came when they built the tower. And this made, you know, the antenna he had before, but no tower who made the vibration. Therefore, he did both. He moved to another place, and also he removed the mercury things, and now he's totally healed. Other case, which probably is much more interesting for you. There is a village in Switzerland where they built a tower, and then they knew before, and the tower came, they knew that it comes, and they asked the population for what diseases they have, and they asked in another comparable village also. And then the tower began to transmit, the mobile phone tower began to transmit, and after a year and after 2 years, they asked again in both villages, and they found a very significant difference between the mobile phone tower village and the non-mobile phone tower village.
What kind of symptoms were they getting?
They asked for children's concentration problems, children's school problems, ADD, and in adults they asked for heart problems. Arrhythmia, they found a significant increase of arrhythmia, and they found a significant increase of problems in the school children.
Interesting. So can you tell us a few more stories of patients from the clinic where they've actually addressed this issue and they've seen their health restore?
Well, the main problems which we have are headaches, deficiency of concentration, or also back pain. Back pains, especially cervical problems, cervical brachial problems of the cervical spine, back pains, but also from the lower spine. Because the tension of the muscles gets more, they get a little bit more spastic, and this builds a continuous pressure, and the continuous pressure makes the problem. Migraine, vision problems is when such a patient comes, my first diagnostic thing is testing for electromagnetic load. We work together with an institute who measures the homes of patients. They go measure the electromagnetic load. Then they either insulate the house or they change. It's not only the mobile phone towers, it's also the portable house phones, which have a very significant electromagnetic load, and they change this, and the patients get better. Very frequent is also, I have many examples, very frequent is the sleeping disturbance. For example, we insulate, we have a tower in our private house which sends to the village, and we insulated the house, we changed the walls and the windows, there are possibilities to insulate, and we put our children out of the room which is directed to, we just changed their rooms, and on the day after changing, they slept better. Before, our son fell out of the bed nearly every night. Afterwards, no more.
Besides actually going and having this institute measure in people's homes to see what the load is there, do you have measures in the clinic that you use to assess whether somebody is actually reacting to the fields?
We have methods which we can use. It is bioresonance. It's a fine energetic way, and the very important thing is that we can measure with a scientific measurement the function of the unconscious nerve system, the parasympathetic and the sympathetic nerve system, which should balance, and they no more do when you have such electromagnetic load, and this we can measure.
Is that using the heart rate variability?
Yes, it's the heart rate variability. We have a more refined instrument than only the heart rate variability, but it's the same principle behind.
Now, we've talked a little bit about the acute kind of symptoms that people get, the headaches, the insomnia, and difficulty concentrating, and so on. What do we know about the connection between these kind of invisible stressors on our bodies and chronic illnesses? Things like diabetes, cancers, neurological conditions.
Our clinic treats a lot of cancer patients in all stages. And since we know about these relationships, relations between electromagnetic and chronic diseases, we measure in all cancer patients. And nowadays I'm really convinced that electromagnetic load from different sources, of course, are a very important factor to the building of cancer. What is very important is that the cancer, the electromagnetic load leads to a deficiency, a long-term deficiency of the pituitary gland, sleeping disturbances, for example, regulation of the thyroid, and also of the adrenal gland. The stress capacity decreases significantly, and I think that's the main factor which makes patients weak when they have electromagnetic load.
Very interesting. So with all of your cancer patients then, would you incorporate electromagnetic field remediation strategies?
Yes, we sent this institute, these colleagues from they call themselves Geopathological Institute of Switzerland, and we sent them to their home, and they have to measure, and they have to change. If there is load, they have to change. You know, with simple things you can decrease the load, and they do this. It's one of our trainings which we give to cancer patients to be aware and to avoid as much as possible mobile phone, portable cell phones at home, in the house. They are even worse than mobile phones. Or television in the sleeping room, such things which very much main contributor to the electromagnetic load.
So besides cancer patients, what about for patients that have Parkinson's and Alzheimer's and other neurological types of conditions? Are you giving them the same kind of advice?
Well, on Alzheimer's, it is difficult because very often it does not influence much, even though perhaps electromagnetic load was one of the factors which led to the beginning of Alzheimer's. Parkinson's, it's different. On Parkinson patients, we have several who profited a lot from our advices, electromagnetic advices. But others, neurological, for example, concentration deficiency, even mental problems like depression or anxiety or sleep disturbance, they profit very much from the anti-electromagnetic training.
Are you concerned about the number of children that are now being born with autism? And do you think there's a connection there?
Well, children born with autism, I doubt very much if they are really born with autism. It is possible, but the fact that they get autistic normally only appears after several months to years. So on birth time, we can't really judge, but afterwards. And then they are also vaccinated. We think that vaccinations have a very, very bad effect for building autism. But of course, an autistic child has to be free of electromagnetic load. That's very important, because it loads the brain also, it blocks the brain activity, and this is just fatal for a child.
Mm-hmm. I'm curious, in the way that the electromagnetic fields affect the brain and concentration, are people's lives becoming significantly affected? I mean, to what degree are people becoming impaired? Is it just a little mild difficulty focusing, or is it such that people can't do their jobs and can't function in life?
All facets are possible. We have patients who got invalidized, and we have others who a little bit were compromised. This really can be very different. I ask normally to patients, when are the symptoms the most? Are they more on your job? Are they more at home? How do you sleep? When do you have your headaches? How is it when you go for a week or 2 weeks to holidays? Is it also the same? Do you use your mobile phone? Do you use it with the ear plug or without? Because this makes a huge difference. And, I forgot before, do you have tinnitus? Because tinnitus is, I would say, 90% due to the electromagnetic load.
Mm-hmm. Interesting. I know you place a lot of emphasis there on maintaining the proper balance of flora in the body. And in fact, I remember you once saying that we have more microorganisms in the body than we have cells. How do electromagnetic fields impact these microorganisms, and with what consequences?
Well, very much. There are studies about bacteria cultures, about other bacteria growing. When you have a culture of normal human bacteria, they grow much less. When you radiate them with a mobile phone tower, they grow less. When they are around the house station of a mobile, these portable phones, they are very bad too. When you have cultures close to such a station, they grow less. And growing bacteria in your body less, your good bacteria, means that you will have an overgrowth of other microorganisms, like, for example, Borrelia, Babesia, Chlamydia, and so on. And this is a contributing factor to Lyme's disease, for example.
So this is very interesting. And so it's because the good bacteria grows less, so then it's dominated by the bad ones that you don't want.
We have Lyme's, especially from the East Coast, New York, Providence, Boston, Philadelphia. From these towns we have many Lyme disease patients with a long career. They are always treated against the bacteria, against the bed bug, and so on. Antibiotics only makes it worse on a long time. And what we do is we look, how is the good flora? Does it recover? We make cultures. We see they no more grow, so we have to re-implant the good bacteria, and we have a real strong intestinal program, and within 6 weeks the Lyme patients get healed, or get at least much, much, much better.
Very interesting. Now, I've also heard that mold in houses grows faster in high electromagnetic environments.
Very much so, very much. The mold grows much faster under the load of electromagnetic load. Mold grows when you have a disturbed milieu. The disturbance of the milieu for mold, for fungi, can be due to the amalgam, heavy metal, mercury. Cadmium is very important from smoke, but also it can be from electromagnetic load.
Let's go back to what's happening in Europe. I heard that a couple months ago the European Parliament voted 522 to 16 to recommend countries there lower exposure guidelines for electromagnetic fields so that they reflect the science that shows the biological effects. That was very encouraging to hear. And then Liechtenstein became the first country to actually put it into law. And then I heard the other day that in southern France there's some white zone, EMF white zone, being developed. What's happening in Europe? Are they just more aware of this issue there, or are you seeing worse consequences there? In the United States, nobody really seems to be understanding the importance of this issue, seeing it as a very important public health issue. It sounds like things are happening over there that will suggest that you understand this issue better.
Well, I think in the United States you have a different system of television stations and in so-called information. And you have more one opinion which spreads over the whole country. Then we have here the different countries, even though we have the European Union, but the different countries are different. They have different radio stations, different newspapers, and so on. So it's more difficult to wash one opinion over whole Europe. So there the multiplexity of the opinions is still better than in the United States, which is good, of course. And the countries are still a little bit different. For example, Luxembourg is quite advanced. Switzerland is somehow in the middle. France, I would say, as Italy, they are very much behind. They have little understanding of electromagnetic things. They have the highest concentration of atomic power stations in the world, France. And so the knowledge about such things is still small. And the northern countries like Norway, Finland, they are very much advanced, and they bring out laws. For example, in Sweden it's forbidden to put amalgam in teeth. They also have stricter laws for electromagnetic power stations.
So are physicians activated over there? Are they advocates for the public health on this electromagnetic issue?
Got much better in the last years due to the work and the information of patient groups who were very active, and due to the information of such institutions like our Geopathological Institute Switzerland and such activities.
So now in the U.S., schools have started putting up antennas on their properties and in their schoolyards, and what I'm wondering is, and you're collecting money for this, is that happening over there too? And what's being done about it there? It seems to be crazy to do something like that if we know that it's going to impair concentration and obviously impair learning.
Well, this is I can't say other than criminal, because it's unethical to expose children to electromagnetic load in this way. We know that power stations for electromagnetic waves, like mobile phones, are hurting the brains of children. So to put such stations into schools is really very, very, very bad. The question is, does the school or does the society really want to have intelligent, well-educated children or not? I know it's a very cynic question, but if you instill mobile phone towers which radiate to the children, their intelligence, their brain capacity decreases. You will have more ADD children. You will have less function of the brain, which on a long term reflects on the intelligence of the children, of the possibility to really teach children, and on a long term, when the more this overcomes the society, the more we will have dumb children.
Is it just a matter of time before we all just dull our brain, even if we're not being affected now? Maybe, in a year or two, 5 years, 10 years, a large percentage of the population will be affected?
This is absolutely clearly my opinion, yes.
Interesting. What is your understanding of the effects of these fields on the emotions? You mentioned before that there was some connection with depression, and we've seen a huge skyrocketing of depression over the past 10, 15 years here. What do we know about the impact of these fields on the emotional balance in the human being?
There are many causes. I would not say electromagnetic is the only cause, but it's one of the many causes. It's like a puzzle of load. You have many different pieces which adds to one another, and the addition makes the fatal effect. It's the wrong nutrition, the too much sugar, the increased toxicity, the toxins in the air, in the water, the toxins from the teeth, and so on, the wrong bacteria, and on top of all this, the horrible situation with electromagnetic load.
So stresses on the body from these fields that are creating the attention problems and the disruption, are they also, do you think, impacting people's ability to interact well with other people?
Yes. The sympathetic action increases, the parasympathetic recovering, peaceful action in the body decreases. That's what these loads do. And by increasing the sympathetic action in your body, you get more animosity in yourself. You get more aggression.
Mm-hmm.
You get less of peaceful approach to items. And this interferes with the whole society very, very much.
Very interesting. So what needs to happen next? Are governments responding appropriately at this point to the public health crisis that's emerging?
Well, if the politicians would really listen and they would fulfill their duty, not only follow the suggestions of the industry, then they would have the duty to reduce such loads. But it's not only the politicians who are the bad guys and they don't listen to new scientific works and so on, but it's also the individual which is very undifferentiated in using all these technologies. I ask my patients, do you use a mobile phone? I ask the patients, do you let the television in your room on electricity at night? I ask, do you have a portable phone in your house or a fixed station which has about 1/100th of the radiation? I ask such things. And do you take minerals and trace elements? Have you ever been to a biological doctor who can measure your resistance to electromagnetic? And then I see that they don't do anything. Well, so who wonders when you are sick? It would be similar. Running on a road, over a road when traffic is there is dangerous. So do you protect yourself and do you look left and right before you go over the road? Do you do something to protect you? Everybody says yes. But do you something to protect you from other dangers? No.
So do you think it's a level of denial?
Yes, it's a high level of ignorance of the politicians, but also of the population. But it's also a level of denial because they would need to do something different.
Do you think that this is a species type of an issue, like people focused on global warming, they're concerned about the survival of our species? Is this problem in the same category?
That's a difficult and that's a very interesting question.
I mean, it's affecting DNA and it's, leading to all kinds of health problems and lessen quality of life. What is the trajectory ultimately?
The high toxicity and the electromagnetic load for sure changes the DNA on a long term. And it changes, even in lifetime, it can change the DNA and it can make the expression of the genes different.
Dr. Thomas Rau, thank you very, very much for being with us here on electromagnetic health.org. Appreciate your insight.
Thank you very much and all the best to you.